Abortions are one of the most controversial health issues in today's world. All over the world, pro-choice and sexual and reproductive rights advocates on one side and anti-abortion demonstrators on the other have taken to the streets and raised their voices for what they believe in. The polarization of the debate stems from discussions about religion, personhood and morality, autonomy and women's rights as human rights.
Mi postura frente a la despenalización del aborto es a favor de la libre decisión de las mujeres a practicarlo y también a favor precisamente de los derechos humanos. ¿Sí? Considero que es un tema principalmente de derechos humanos. Considero que es muy importante la autonomía de las mujeres o la libertad de decidir sobre su cuerpo. En una posición en la que, bueno, no es libre de decidir, ¿sí?, sobre su cuerpo, y bueno, en ese sentido también falta que el Estado le garantice precisamente esa libertad de decisión y también sobre la salud de la mujer, ¿no?
As a public health issue, it has been estimated that almost 23,000 women die each year as a result of complications from unsafe abortions. Abortions are a matter of public health, social justice, and human rights. The criminalization of and stigma surrounding abortions do not decrease the number of women having abortions. Instead, it only causes increases in maternal mortality and morbidity.
Mujeres de todas maneras abortan y lo hacen de manera insegura, insalubre, arriesgando incluso su patrimonio.
According to the World Health Organization, almost every death resulting from unsafe abortions could be prevented through access to safe and legal abortion services. However, 41% of women of reproductive age live in countries with restrictive abortion laws.
Latin American countries, for example, have some of the most restrictive reproductive health laws and policies in the world, particularly with regards to abortions, and has the highest proportional number of maternal deaths as a result of unsafe abortions in the world. In Mexico, abortions are a very legally restricted procedure and are currently carried out clandestinely throughout the country, except in Mexico City. Since April 2007, the termination of pregnancy is legal in Mexico City if it is carried out within the first 12 weeks of gestation. Abortions have also been decriminalized in the state of Oaxaca since September 2019.
In addition to being an infringement to women's rights to health and their sexual and reproductive rights, abortion is also a matter of class and intersectional discrimination. Women already facing structural gender violence, as well as other kinds of discrimination, are the ones forced to turn to unsafe practices in context of great inequality.
Actualmente es uno de los estados con los más altos índices de violencia hacia la mujer, lo que significa que las mujeres están siendo abusadas sexualmente, así como física y psicológicamente. La despenalización del aborto les pone en una posición completamente diferente, ya que les da el derecho a decidir sobre su cuerpo, así como su vida sexual y reproductiva.
Even in places where the termination of an unwanted pregnancy is legal, there are still issues with access to health services for women to exercise their rights.
In response to these obstacles to access, we find new trends in the abortion debate. The self-management of health that includes medical abortion, telemedicine as resources to make possible the access of women to safe and free abortions, and accompaniment to exercise abortion as a right.
For the World Health Organization, self-care interventions are among the most promising and exciting new approaches to improve health and well-being, both from a health system's perspective and for people who use these interventions. Medically induced abortion using drugs such as misoprostol and mephistrone are an example of intervention which could be self-managed by patients outside of the traditional healthcare setting. This represents a challenge for health systems, allowing women the opportunity to have more control over the decision to terminate their pregnancy in a safe manner.
Creo que hoy, 10 años, hemos avanzado muchísimo. De hecho, ya hay varios estudios donde es la misma seguridad, que no solamente que lo diga la OMS, sino la vivencia de las mujeres, el acompañamiento sin supervisión médica, como hacerse un aborto en condiciones seguras y salubres en lugares adecuados como son los servicios de salud, ¿no?
The final step in the self-management of abortions at its exercise as a right for women is the process of accompaniment.
In addition to information, quality services, and medical abortion pills, women need emotional support and empathy throughout the process in order to maximize safety, effectiveness, and quality of care. To address this challenge, various accompaniment models have been developed. There are numerous groups and networks that work to provide information and accompaniment to women who decide to terminate their pregnancies, all over the world, including Latin America. In Mexico, such collectives are found in almost all states, and some networks provide attention at the regional or national level.
En los últimos años hemos ido desarrollando diversas redes de acompañamiento, formando en acompañamiento, y me parece que hoy en México, en América Latina, en el mundo del movimiento feminista, de los derechos sexuales y reproductivos, del aborto en general, no solamente las organizaciones, sino la ciencia, la Organización Mundial de la Salud, la Organización Panamericana, las organizaciones internacionales, los fondos, la cooperación internacional. Hoy, cuando una habla del acompañamiento, creo que todo mundo entendemos qué es eso, proveer a las mujeres información, estar físicamente o no, incluso vía el teléfono. Entonces nosotras vamos a proporcionar todos los recursos humanos, de vida, económicos, los que se necesiten para que todas las mujeres lo vivan como un derecho, salgan de esa vivencia fortalecidas.
These new trends in the abortion domain and accompaniment in particular raise a number of new ethical dilemmas. In Abigail Aiken's words, when people think about self-sourced or self-induced abortion, they tend to think about coat hangers or cool steel tables in back alleys. But these findings showed that in 1917, self-sourced abortion involves a network of people helping and supporting each other through a safe and effective process in their own homes. That's a huge step forward for public health. Our approach is human rights-based. We understand abortions as a matter of social and reproductive justice. Our main argument is that self-induced and safe abortions represent actions taken by women protected by the principle of autonomy. The idea of health self-management stands with taking charge of your own medical needs, which is necessary considering that the options available for women living in rural areas of Mexico are not only illegal but expensive, painful, and filled with stigmatization. Including this method in public health policies nationwide could broaden the scope of attention and access to safe, legal, and free abortions. This also represents a low-cost policy to the government and a way in which the state would also be guaranteeing human rights of women and promoting reproductive justice. This method has shown to be effective, not harmful, and of equitable access to poor and distant communities. This supports both the beneficence principle and justice principle.
Hemos enfrentado más dilemas éticos con las propias mujeres. Las propias mujeres que hemos acompañado nos han planteado dilemas éticos, ¿no? Nosotras, por ejemplo, jamás hubiéramos imaginado, eso lo hemos aprendido con ellas como un dilema ético, es la permanencia con la pareja con la que se embaraza, ¿no? Y eso lo hemos aprendido de acompañar a las mujeres, son las que nos traen los dilemas éticos de cómo irlo resolviendo. Otro dilema ético es el tema del aborto y la violencia, ¿no? O sea, cómo trabajar ambos temas sin que uno se superponga al otro, ¿no? Otro dilema ético es cuando han llegado mujeres muy pocas y nos han dicho que quieren dar en adopción, pues también las acompañamos en esa decisión. O sea, si nosotras decimos que las acompañamos en su decisión, pues también las vamos a acompañar en esa decisión de la adopción. Han sido pocas mujeres, pero también nos lo han planteado, porque nosotras podíamos haber dicho que aquí acompañamos para interrumpir embarazos no deseados, ¿no? En otra ventanilla es para adopción. Pero nosotras nos plantean esos dilemas éticos y los hemos resuelto con ellas. Entonces, sí, esos dilemas éticos que creo hemos enfrentado en este camino, nos los han puesto mayoritariamente las mujeres, pero también los hemos resuelto bien porque los resolvemos con ellas, ¿no?
Accompaniment for self-managed abortions is a response by women's rights activists, feminist collectives, and women in need, generally speaking. Beyond the medical aspects of abortion, accompaniment addresses women's right to health in a holistic manner, considering mental, emotional, and social health. In countries where abortions are criminalized not only by law but by society, such initiatives are a sign of resilience and empathy. Altogether, these three principles, autonomy, justice, and beneficence, inspire the accompaniment space that is being built by women and for women to support each other through the abortion process. And being prepared to help with information, advice, contacts, and showing solidarity is one of the methods that has helped women carry on with an abortion and even has helped them stay strong after one. We also consider that this represents a way in which women can exercise their rights without being stigmatized at a hospital, looked upon social, or frightened by the sterility that the process is performed. This has to change, and we are working on it, but meanwhile, Miss Uppersall for you and me.
Que ahora hemos hecho Las Libres y otras redes es construir una política de acompañamiento que nosotras incluso la hemos conceptualizado como una política no estatal de las mujeres. Es decir, las mujeres nos estamos organizando para protegernos, para vivenciar nuestros derechos, para luchar por la despenalización, pero mientras eso ocurre, que mujer por mujer, creo que dicho de otra manera, es poner el cuerpo, acompañar con el cuerpo a la otra mujer, acompañar con la solidaridad, acompañar a que escucharla, para que se vaya despenalizando socialmente. Las mujeres ojalá nunca más mueran, nunca más su salud esté en riesgo, nunca más su libertad esté en riesgo y sobre todo sus decisiones sean respetadas.
Educación sexual para las